This is a video just to give you the basic information when you've just had your ACL reconstruction, especially for that first 2 weeks of what to do with your knee to help it recover ideally. So you're going to be pretty sore, so taking your pain relief and getting the knee to settle down is the number one priority in that first 2 weeks. So the most important thing is elevation. So lying on your back, knee above the level of your heart, so it's up on 2 or 3 pillows or up on a wedge, so that the swelling settles down and your knee will feel better in that position. You usually have a compression bandage on your knee. Some of the surgeons will like you to keep that on for 2 or 3 days. Now, after that comes off, you can definitely ice your knee. Ice packs we usually suggest you use for about 20 minutes and every couple of hours to try and ice it at least. And that'll help settle things down as well, pain-wise as well as the swelling. So your exercises that you want to do to ideally recover are just to get your knee moving a little bit. So when you're laying down on your back with your leg up, say it's my right knee, you're going to do a really simple little heel slide up and down. We don't want to push it past that 90-degree point, so you just want to go nice and gentle up and down with your leg. If that's really sore, you may even help with your own hands or have someone else help you. Just bend it up and down a little bit. It's just to get a little bit of movement in the knee and not irritate things. So if you're pushing through pain, you're doing too much. The other little exercise we might do with a little rolled up towel or pillow under your knee if you need it, but doing a tense up of your quads and hamstrings together. So you're tensing up those muscles, holding it tight for about 5 to 10 seconds and then relaxing. So it's just a static exercise, you're not moving. The closer to full extension you can do that exercise, the better. But when it is sore, to have a little pillow or towel or a little gap underneath your knee is ideal. And then the third exercise is really just for circulation, just pumping your foot up and down. This one we suggest you do lots of. So every hour you want to do 10 of those every hour on the hour, as big as you can up and down with your foot, just to get circulation going through your legs so you don't get blood clots and pooling of swelling and things like that. So they're the 3 simplest exercises. But generally the rules that we tell people is if it does hurt, you're doing too much. If it swells up, you're definitely doing too much. You shouldn't be getting up and walking around too much. You'll generally be non-weight bearing, so you'll be on crutches. And you've just got to get around the minimum amount. Go to the toilet, get something to eat, go back, lay down, put your leg up. If you're not sure of any of that, definitely ring either your doctor or your physio straight away, because we don't want any extra pain waiting around for things to start moving. By the 2nd week, you should be in seeing your regular physio and doing a little bit more targeted exercises, but that should get you through the first 2 weeks of the recovery.